Hi, I'm Katherine Barnard. I'm a clinical associate professor of family medicine here at UMass. I'm also a graduate of UMass Medical School, the class of 2000. I came to UMass with the hope to get broad primary care training because that was the direction I saw myself heading. And after a brief enticement by multiple other specialties, I landed in with family medicine as a choice. And it really felt like the right place to use a combination of interest in procedural skills as well as enjoying the longitudinal connection with patients and an opportunity to incorporate some public health priorities into my day-to-day work. When I had the chance to interview for residency, I looked all over the country and ultimately found that what I wanted in a residency program I could get here at UMass, and was really happy to match at the Hanneman Family Health Center for a family medicine residency here at UMass Worcester. What I was looking for was a training that would give me a good academic background and exposure to a diverse panel of patients, both socioeconomically and ethnically. I also speak Spanish and was interested in having the opportunity to keep up use of Spanish in care of patients, and got to do all of that here at UMass. Part of my training involved a longitudinal elective at a satellite clinic of Hanneman Family Health, which is called Plumley Village Health Services. Plumley is a low-income housing development here in Worcester, and the clinic had been started now 25 years ago in an effort to bring primary care to that underserved, mostly Hispanic community within Worcester. And so the longitudinal elective involved being able to spend a day a week working at that clinic, taking care of the primary care patients there. We did a high volume of care for children and young families, a lot of women's health, with the opportunity to follow those patients through their pregnancy and do their deliveries. And luckily enough for me, as I was finishing residency, a job was open to stay at Plumley as a physician dedicated to work at that clinic. And that's where I've been for the last 13 years, which has been a fabulous experience in terms of being able to take care of a patient population that I really enjoy, taking care of patients in a way that really incorporates objectives of public health improvement into our primary care work, and also leadership opportunity in that I, shortly after starting, took on the medical directorship of the clinic and have been able to see it through growth and expansion, as well as incorporating new national initiatives such as patient-centered medical home and practice transformation initiatives. So I really enjoy what I do. I love taking care of patients. I love to think about how the work that we do as primary care providers fits into the needs of a neighborhood or a community. I also really enjoy teaching, and that's been a unique opportunity here at UMass, is to join together my clinical interests as well as teaching medical students and residents. There is such a large, diverse department here that it seems that almost any clinical interest or research interest that one could have, you would be able to find a mentor or a colleague with which to explore that. And that really adds to the richness of our experience when we get together as a department and have opportunities to share and hear what work is happening in other departments. So Worcester's been a fabulous place to work and to train, and I encourage you to look into it.